This video is for informational and educational purposes only and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician and other qualified healthcare provider with any questions you might have regarding a medical condition. The creator of this video, me, and ADHD Queens are not liable for any actions taken or decisions made based on the information provided. A long time ago, in a galaxy far, far away, you forgot to take your meds. This is episode 4, A New Hope. Your meds! Hi, everybody. Dr. Erin Patterson here with the ADHD Queens podcast. And today we're talking about your meds. Well, not your meds, but meds in general for ADHD specifically. Dropped the bone on my toe. So I have had so many questions from people about what medications are available. How do the medications work? Why should we medicate? Can I do this without medication? Because people are scared of medication sometimes. So let's start off by talking about why should we medicate? Remember, medicate, caffeinate, hydrate. That's my rule. So it is important to know that 80% of children and well over 80% of adults are going to need to be medicated for their ADHD at some point in their life. It is just the nature of the beast. If you think about ADHD as a biological issue rather than a psychological issue, even though it happens in your brain, I like to compare it to diabetes. The issue with diabetes, let's say if you have type 1 diabetes, which is something that you're born with because of your genetics, your pancreas does not make enough insulin, and therefore you have to purchase insulin, have an insulin pump, give yourself insulin shots, and do lots of things to medicate and treat and manage this disease. ADHD is very similar. It is a biological issue with your brain that it doesn't make enough dopamine, and so sometimes we have to buy the dopamine. If you're not getting prescription dopamine, you're buying dopamine in different ways. Like all of the carbs that we eat, you eat them, carbs turn into sugar, sugar turns into dopamine. So you're self-medicating that way. Or maybe you're just eating the sugar straight up and you're craving candies and cookies and things like that. Sugar turns into dopamine. You get a little dopamine hit from it. Or, you're drinking 4 or 5 Monsters, Red Bulls, Venoms, whatever all these energy drinks are every day to keep yourself functioning. So if you're not gonna medicate it with prescription dopamine, then you're probably looking for other ways to get the dopamine, or you're just not functioning very well. So I think it's important to keep in mind, it's okay to, if you can't make it homemade, store-bought is fine. We've got 3 options for medicating ADHD. And stimulants and atomoxetine, which is Strattera, are the most effective treatments for ADHD. Even more effective than therapy, which is saying a lot because, of course, I want everybody to go to therapy. Everybody should be getting therapy. But therapy also doesn't help diabetes be any better. You can't therapize your pancreas into making insulin, just like you can't therapize your brain into making dopamine. You can help it, but it's not going to be the same. And actually, medication, stimulant therapy, and atomoxetine are twice as effective at treating ADHD than therapy is. So that's kind of sad for me, but it's the truth. And I want you to know the truth. Also, they've been around for years and years and years and years, decades even. And the safety of these medications has been well established. And they improve ADHD symptoms in 70 to 90% of cases. So it's very worth exploring. All right, so what are the different kinds of medications? Now, this is an interesting fact. There are 43 medications currently available that stimulate the brain the same way that amphetamine and methylphenidate do. But only 3 of those 43 medications help ADHD. The other 40 make it worse. So we have very specific medications that are effective for the treatment of ADHD brain. ADHD symptoms, not ADHD brain, whatever. I'm going to take a little aside and talk about attention for just a minute. In previous episodes, I have mentioned the issue that the ADHD brain has in prioritizing the intake of information. When we talked about being overstimulated in the last episode, I mentioned a little bit about all of these sensory things coming in at the same time, and that's what creates being overstimulated. So the non-ADHD brain has the ability to organize information in a vertical sort of what's important, what's next important, and what's least important arrangement. The ADHD brain is not so good at doing that. So let's say we're sitting at the park and there's somebody playing basketball. And there's somebody playing basketball over there. And there's somebody skating over here. And we're reading a book. And there's a dog somewhere. The ADHD brain brings in all of those information sources at the same level of importance. They're all coming in at the same time. The book is just as important as the dog barking, is just as important as the skating and the basketball. And so it's very difficult for us to just look at the book and read and focus on the book. The non-ADHD brain flips that around and says the book is most important. And I only need to worry about this dog if it comes into my field of personal space, or the basketball. If it comes to my face, I need to pay attention to that. So the non-ADHD brain does a better job at prioritizing information. So that particular skill happens in a part of the brain called the corpus striatum. Now, this is your little administrative assistant in there that scans all of your thoughts and all of your feelings and all of your experiences, and it tells you what is the most important thing that your your prefrontal cortex, your cortex, needs to think about. Now, the problem with the ADHD brain is that this corpus striatum is not able to prioritize. And so instead of just sending one thing, it's sending multiple things. So here's a quote from Dr. William Dodson. The current theory of ADHD is that the striatum works 99% as well as it does in neurotypical brains. Rather than sending only one important thing to the frontal cortex, it sends 5 or 6 things with no particular significance attached to any of them. So that's where some of the biology comes in. Your signal system is sending too much information to your brain. It's distracting you. It's causing you to think this is just as important as this is just as important as that. And that's where the distraction comes from. That's where the sensory overload comes from. All of those things. And so methylphenidate, one of the options of stimulant therapy for treating ADHD, goes particularly into the corpus striatum and helps slow it down so it can just send one thing or 2 things instead of 5 or 6 things. So let's talk about the different types of medication. Number 1, stimulants. This is the one everybody's afraid of. Oh no, a stimulant! Ah! Okay, so we've got 2 different kinds of stimulants. Now, stimulants are also known as dopamine agonists. They agonize your dopamine. Remember when we learned the term dopaminergic? That was in episode 1, right? Anyway, so just comparing it to diabetes, right? We've got a dopamine issue in the brain. Diabetes is an insulin issue. So the stimulants are dopamine agonists, which means that they act on our dopamine levels. So we've got methylphenidate, which is Concerta. I think now Jornay is one that you can take in the evening that has like a long time delay on it, so it's working by the time you wake up. Those fall in the methylphenidate category. Those were coming about into the world in the 1950s. Then we've got the even older ones, the amphetamines, which people are really scared of. It is not methamphetamine. It is not the same thing. It is similar, but It is prescription and it is safe and it's been around since the 30s. And that's what I take and it's safe and, I'm not a crackhead. It's fine. I just act like one. But that's when I don't have my medication. Okay. Non-stimulants. So the non-stimulants work on a neurotransmitter called norepinephrine. And it is atomoxetine, or Strattera is the name of the non-stimulant that's approved for ADHD treatment. And what it does is keeps the norepinephrine from being sucked back up into the brain. I have a demonstration for later. And then there is the category of, it's called the alpha-2 agonists. These are extended release, and they are used to treat more of the impulsivity. So a lot of times they will be added in addition to a stimulant therapy or a non-stimulant therapy. And these are guanfacine, which is Intuitive is the brand name for that. And then clonidine, which is Capve. All right, so our three categories are stimulants, or ones that work on dopamine, non-stimulants, or ones that work on norepinephrine, and then the alpha-2 agonists, which are Intuitive and Capve and work with impulsivity. We're going to focus on the stimulants and the non-stimulants. So how do these meds work? It's time for visuals. Way back when, in high school biology, we learned about the synapses in the brain. There is the part of the brain that shoots out all of the neurotransmitters, and then there's the part of the brain that reuptakes those neurotransmitters or sucks them back up so that they can be reused. You can't leave the neurotransmitters in the synapse all the time. It's not good for our brain to do that. So we are going to demonstrate how these medications work with the use of glitter and a dustbuster. All right, green sequins are norepinephrine. Oh dear. Ugh. I knew that was going to happen. I'll be with you. I'll be with you momentarily. So, your brain shoots out norepinephrine. Just like that. All into your brain. Okay? And it shoots out dopamine. So in the non-ADHD brain, the norepinephrine, the dopamine stays in the brain for a sustained period of time. It's absorbed and released, and there's this consistent sort of, levels throughout the day. In the ADHD brain, what happens is it gets released, and then it gets sucked up very quickly. It is reuptake by the brain. But then, in order to release more dopamine, we need to change tasks, or we need to pick up our phone and see what's happening, or we need to, I need to call my friend, or, I need to go do the dishes, or, whatever. I'm going to binge watch TV, or eat a cupcake, okay? And so then, again, it's sucked up very quickly. So, like I mentioned before, we're chasing these dopamine hits all day long. So it adds more dopamine to the brain. And the second part of what the medication does is it prevents the reuptake from uptaking. So it blocks the ability for your reuptake things to reuptake. So the dopamine, that smells bad. The dopamine stays in your system for longer and in a more steady way. So you're not getting these ups and downs and these spikes and all of those things. And then when the medication wears off, your body begins to reuptake the dopamine. The atomoxetine, the non-stimulant, works in the same way, but instead of working on the dopamine, it works on the norepinephrine. So it prevents the little green things from being sucked up. Anyway, at the end of the day, when the medication comes out of your system, because it's short acting, just like if you drink a coffee, it's in your system and then it's out of your system at some point in that day. It doesn't last forever. When the medication wears off, your brain goes back to its pre-medicated form of dopamine and norepinephrine regulation, and then we're back to our natural state. So let's talk about the delivery systems, because some of these are very ingenious, okay? We've got what they call the 5 Ps: the pill, the pump, the pellets, the patch, and the prodrug. I know, I count to 5 weird. Just ignore it. So the pills are going to be immediate release stimulants, not extended release stimulants. And so that would be things like Adderall, instant release, IR. And so you take that, it goes into your stomach starts breaking it down, your stomach lining absorbs it, it hits your bloodstream, and you've got medication in your system in about 30 minutes. The immediate releases typically last 3 to 5 hours, and so a lot of times with those, you're going to have to take an afternoon dose. Some people even take 3 doses during the day, and a lot of people who have ADHD actually require more medication in the afternoon. Like the mornings are a little bit easier because we have a natural kind of higher dopamine level in the morning between 8 and 12. And it's the afternoon that gets a little harder. You know, we've got like system fatigue. We've been peopling all day and using our brains. And then it's like, the more tired we get, the worse the symptoms get a lot of times. So with the immediate release, the pill, you know, you're going to probably have to take multiple doses. A lot of people say, I have a hard time remembering to take my afternoon medicine. Well, my body tells me when it's time. I can feel like I start to get overwhelmed, or I start to, you know, have some, I'm frustrated or feeling overwhelmed or overstimulated. And I'm like, yep, it's time for that afternoon dose. So I take my afternoon dose and I'm good for the rest of the day. I feel like you have a little more flexibility when you take an immediate release, because, you know, if you just need a half a dose, you can chop those pills in half and, you know, take a baby dose if you need it. And then they also have extended release pills. So that would be Adderall ER, extended release. And they have a coating on the outside of them, which gives you immediate medication. And then there's layers to the pill that break down over time. So it might be a layer of medication and a placebo layer, and then a layer of medication and a placebo layer. And so it keeps it at a more steady amount of medication in your bloodstream through the day. The second kind is the osmotic pump, and this is a really cool one. These are typically found in Concerta, is one of the name brands, the methylphenidate that uses the pump. So it's a capsule, and on the outside of the capsule is some medication. So you get an immediate release of medication into the bloodstream. But inside the capsule, there are 3 chambers, and there's a little laser hole drilled in the top of the capsule. And as the fluid from your stomach fills the capsule, it pushes the medication, which is in gel form, out of this little hole. And so the reason it has 2 or 3 chambers is because the first chamber is a little bit lower dose for your morning, and then the second chamber is what your body gets to in the afternoon. So it's filling up with water and pushing out this medication throughout the day. And then it's all done doing its thing and you poop the capsule out, which most people don't realize that. But, you know, if you take Concerta or methylphenidate, you might want to go, you know, exploring to see if you've ever seen one in your, you know, duty. Okay, then we've got pellets, third kind. So these are capsules that can be broken apart, and they have all of the little pellets in it. Those are good for, you know, people who can't swallow pills or capsules. because you can break them apart and put them into some applesauce and eat them if you'd like to do that. And the pellets, some of the pellets have low doses, and some of the pellets have higher doses. And so some of the pellets are immediate release and some of the pellets are extended release. And so you kind of get a variety there, but that also gives you an extended release of the medication throughout the day. The fourth P is the skin patch, and you can wear it on your shoulder blade or you can wear it on your hip. These, I think they're called the Daytrana patches, and this is good for also an extended release of medication throughout the day. Side effect that kind of comes along with this one, though, is, people who are, a lot of people, like about 15% of patients who used it ended up with a rash. A lot of people are allergic to adhesives, and so that may not work for everybody. But yeah, you just absorb the medication directly through your skin into your bloodstream. Now, this one is important. There is, when you take that patch off, there is still a lot of medication in that patch, so you need to dispose of it safely. Don't just throw it somewhere where a pet or a small child could put it in their mouth, because you're going to get a big dose of medication all at once if somebody ingests that. Okay, then we've got the fifth P is the prodrug, and this is Vyvanse essentially. So they came up with this so that it would be less abused. It's still a stimulant, but what they've done is they have taken the an extra molecule, attached it to it, and so there needs to be an enzyme present in order for this medication to start working. So you take the Vyvanse, your stomach and your liver start to process this. It breaks off this extra molecule, and then it makes the medication available in your bloodstream. So a lot of doctors like to give Vyvanse because it has less chance of being, abused. And also it just has like a really good, long, extended sort of delivery system. So people, sometimes report like 10 to 12, even up to 14 hours of medication for Vyvanse. So most people I know, are saying between 8 and 10. I'm not really hearing people say, oh yeah, I'm getting 12 to 14 hours of assistance with this. And then they've got the chewable formats. Vyvanse also comes in chewable tablets, and then they have gel also. So what do we do if we get on some kind of medication and it's not working? All right, so there's 3 things to consider. Let's say you were prescribed methylphenidate and it's not working. You don't feel any benefit of it. The first thing to adjust is the dose. We want to make sure that you're getting the dose right. It could be a little bit higher. You could need a little bit less if you're feeling over-medicated. If you're feeling zombified or, too keyed up, the dose can be changed and lessened. A lot of times adults even will do better on lower doses, I think. But if you're not getting the impact that you want, if your symptoms are still pretty severe and not impacted, then maybe we bump the dose up a little bit. So the first line of defense, if the meds aren't working, we're going to look at the dose. The second thing we're going to do is look at the delivery system. So just because this methylphenidate in this osmotic pump, i.e. Concerta, did not work for you, it doesn't mean that methylphenidate in some other form or delivery system would work. So that's the second line of defense. Before we switch to a non-stimulant or something, try a different delivery system. So maybe we switch to the patch. Maybe we switch to the chewable form. Maybe we switch to immediate release versus extended release. And then third line of defense, if you're not having any response to the stimulant therapy, then you can look at non-stimulant options. Now, a lot of prescribers like to start with a non-stimulant option. I just feel like stimulant therapy works better for most people, but some people do just fine with the non-stimulants. So, stimulants are actually effective for between 75 and 80% of people, like right out the gate. So I think it's important to find a prescriber that will work with you and that will listen to you. And if you can get the dose right and the medication, the delivery system, if you can get all of that right, ADHD people with stimulant therapy can actually achieve up to like 92 or 93% effectiveness at managing their symptoms. And that's just like, wow, I only have 7% of my symptoms left. Like, that's a big deal. So I think it's worth looking at. I know a lot of people get nervous about, what if I get addicted to it, or what if I have bad side effects, because we've heard lots of things. It's also important to know that with stimulants, the side effects are more annoying than they're not life-threatening. So we're talking about, okay, it's impacted my appetite, or I'm not able to go to sleep. If you're not able to go to sleep, that means you have too much medication in your system at the end of the day. So we either need to back the dose down, or you need to move it back so that you're taking it earlier. I always talk to people about knowing what your window is when you take a medication. How many hours of impact am I getting out of this? I take my morning Adderall. I'm going to get until about, 3 o'clock, 4:30, and then I need to take my afternoon dose to get me to the rest of the day. If I take that, at 12 o'clock, then I know, okay, I could get to the end of the day just by taking my morning dose at noon. So I'll still be able to go to sleep. So if you're not able to sleep, then we just need to back the time that you're taking the medication up, or we need to back the dose down a bit, or separate it into a morning and afternoon dose. The other side effects, I mentioned the loss of appetite. That's really an issue if you're already underweight. So, despite not being hungry, make sure you've got some protein shakes around, something that you can put in for calories. Speaking of, I need to order me some lunch. My phone is over there. Great. Okay. And then some people have headaches and stomach aches, but those are less common. And usually the side effects can be resolved just by changing the dose. They're dose responsive side effects. So whatever side effect you're having, a different dose is likely to help. Most people don't experience irritability or like increases in nervous habits. If you get any of that, okay, let's change the medication. It's not just because it's a stimulant that's creating that. It's probably that particular medication and that delivery system. So in summary, let's not give the stimulants such a bad name. Oh, I also think it's important to mention that because the ADHD brain has lower levels of dopamine in it to start, adding more dopamine into the system just gets us up to what neurotypical people would be experiencing. If we're hitting that 92, 93% effective rate, we are getting very close to what a neurotypical brain is functioning like. But even if we're not getting that high, if we're getting 75 to 80% effective, we're coming up to right here. The problem is when you have a non-ADHD brain that has a normal level of dopamine in it, and then you add more dopamine to it, that is where the addiction issues come in. ADHD people are typically not going to get addicted to a medication that is helping them function better. They're more likely to get addicted to things when they're not treating their ADHD because they're trying to relieve the symptoms. So you don't have to worry about getting addicted to a stimulant or... Hi. Oh. That's dopamine. Boop. Say hi. Boop. Oh. Problem comes in when a non-ADHD person who has a normal level of dopamine in their brain adds more dopamine into the system. And that's where people get the euphoria and all of the energy and the ability to stay up all night and write their college paper or whatever they're doing with it. ADHD brains don't have to be worried about becoming addicted or dependent on the medication. And I heard somebody say years ago, I think of it like eyeglasses. You didn't go to the eye doctor because you couldn't see and say, oh no, if you told me I was going to need to change my prescription over the years and get a stronger prescription after I had worn these glasses for a little while, then I never would have gotten the glasses in the first place. It doesn't matter that your prescription needs to go up. That's a natural thing that happens even when you're talking about eyesight, And to use that metaphor, I can drive around town without my glasses, but it's better for you if I wear my glasses while I'm driving. I mean, I can ride around town without treating my ADHD, but it's better for you if I'm driving and treating my ADHD. Also, driving in the car is very dangerous for distracted people. ADHDers are the number one people who are going to get in car accidents. I don't know if that's an actual statistic or not. We'll have to fact check me. But distracted driving is not good. So, all right. So I hope that's helpful for you. And don't forget to like, comment, leave us your questions below. We'd love to talk more about this. Subscribe. There's a bell somewhere. All of the things. You can find us on Instagram, Facebook, TikTok, Spotify, Apple Podcast. We're so fancy. Yes. And we might have ADHD, but we're queens with ADHD. Non-queens welcome too. Thanks. See you next time.